Hello, welcome to Wellbeing. I'm Graham Wilson. For most children, hearing clearly is something that we pretty much take for granted. They have young ears, they can hear. But for many Aboriginal and Torres Strait Islander children, chronic ear disease and hearing loss can shape their entire future, affecting speech, learning, and their confidence. My guest on the program today is Professor Kelvin Kong, who's made it his life's work to change that. A proud Worimi man, he combines surgery, research and advocacy through the Hunter Medical Research Institute to tackle one of the country's most persistent childhood health challenges. Kelvin, welcome to the program and thanks for joining us.
Thank you so much for having me on.
Can I hear a little bit about your background first of all? You're widely known as the first Indigenous surgeon. Did you realise you would be that when you were studying?
I think I might start by digressing and just confirming a mistruth there, is that I'm the first Western Indigenous surgeon. We have nunkeries in our culture. We also have traditional healers in Chinese culture. And so in that sense, there have been many Indigenous surgeons across the world, and particularly in the central belt of Australia, we have a lot of nunkeries, actually did lots of procedures. These days, nunkeries are more limited to a lot of the general practice ideas, so it's not necessarily intervention, but certainly they do a lot of healing from that point of view and a lot of psychological and mental healing. I think that's such an important role. And so for me, it would be disrespectful not to acknowledge the nunkeries that we have in that sense. So in a Western sense, absolutely. It breaks my heart, in fact. I'm quite sad by that fact. When I finished surgery in 2007, it was quite lauded and people were quite excited by that. And a bit of my heart actually really broke down, because here we are in 2007. And when you look at the history books and you look at surgery, when surgery was invented, and I think the history of surgery is an absolutely fascinating topic to talk about. But we're talking about the turn of the century, and we're in black and white photos, and even going back to where drawings were available, was no photography, where we had our first surgeons, and it's 2007. Does that mean that we weren't smart enough? Does that mean that we're not actually involved in this? And the reality is it's just lack of opportunity and lack of ability to get in this space. So on one side, I'm quite saddened by it, but in actual fact, absolutely, if it brings and highlights the need for equity and diversity within surgery, then I think that's really important for us.
Have you spent any time looking into the history of Indigenous surgery as such?
Yeah, I spent some time with nunkeries earlier on in my career, and I really enjoyed that aspect of it. Harder because the language barrier was quite difficult for me, not speaking the Arunte language. But it was really nice to have a translator there and just talking about some of the different things that they did see growing up. And particularly my fascination was with the ears. So, talking about the ear disease, and there was ear disease way back then as well. And so hearing the different ways which they did things then with different herbs and different kind of bush medicines was quite an interesting take from that perspective. But ultimately what it really came down to is, how do we make sure that a young child that's born into our culture, into our world, has opportunities like everyone else? And the same principles apply today. And I think that's really nice from that.
Can you talk a bit about your growing up?
Yes, I grew up in Worimi country, and it was quite an interesting area from there. And again, going back to the health kind of aspect of that, my mother was a nurse. She was one of our first Aboriginal nurses who pioneered a lot of work in this space. And she was a true Indigenous health worker or practitioner in a sense, in that we would have a lot of people coming to our house. And so when someone had some kind of problem, ailment, issue, everyone would come around to our house after work, and so it'd be a real hub of activity. So my sisters and I loved it. It was a really nice aspect to come home to this hub of activity, because obviously with one person became a whole lot of family members as well. So there's a lot of activity and flurry and fun and games. And as we got a bit older, my sisters and I used to fight over who would be helping mum, whether it be removing sutures, whether it be helping with immunisations, with Band-Aids, with health questions, immunisations, all kind of weird and wonderful things. We were there trying to fight over that. And I think it really gave me a sense of contributing and giving back, and really enjoyed that aspect of it. And also really was perplexed by my mother as a nurse being the health practitioner in our communities. And my non-Indigenous friends didn't have that. Nelson Bay and Port Stephens area is a beautiful area, wonderful health services there. We have polyclinic, we have a great myriad of GPs. And I started wondering, why did they come to us? Why didn't they just go to the other doctors like my non-Indigenous friends? And you start realising that there is this paucity of service, there is a real paucity of access, and there's a real distance between the have and have-nots in that access. And as a consequence, you saw a lot of chronic disease within our community. And I kind of, again, started staggering me, saying, why should we actually put up with this? Why should we actually have the same kind of existence? If we had the same kind of help everyone else had, would that mean that we'd have a better quality of life? Would that mean we have a better interactions? And that kind of started that journey along that process of being able to give back, particularly in the health field.
What made you choose ear, nose and throat as a specialty?
When I was studying medicine, I managed to come across a few ear, nose and throat surgeons who I really admired. One of them was a gentleman called Peter Carter, and he was a surgeon at Prince of Wales Children's Hospital and Prince of Wales Hospital, and he did a lot of community work. He went out to Barona. He took me out there a couple of times to see some of the work there. He also did some incredible operations. He also had a private practice, and so I really admired him for his balance. He had an amazing life balance. He gave back to the community, but he also did some really cool operations. And I think that kind of naturally fell into that area of inspiration for me. At the same time, in the back of my mind, you see some of the health disparities that we have. And one of the things that really upset me growing up was the lack of opportunity that we have as young Indigenous kids going through. And I probably carry that as a burden, but also carry that as a badge of honour on my sleeve, in that I think with opportunity, some of our young ones can do really well. And that is the same for every kid born in Australia. If you give them the right set of support mechanisms and the right kind of education and the right mechanism to actually draw on their strengths, then any kid in Australia can do anything. And that's why Australia is such a beautiful country, because of that. And so for me, it's really just trying to work out how I can do that in the best way with my opportunities that I've been afforded. And I think ear disease is one of those big things. If you can't hear, you can't learn. And it's so, so important. And so if I start talking very softly, your listeners can't hear me. But suddenly when you start talking loud again, your listeners can hear again. And so it really shows, just a simple experiment can show you how profound hearing loss is. Now, if you're in the classroom and you can't hear the teacher, you're going to lose interest, you're going to start running amok, you're going to start doing other things, you're going to get distracted. And we see a lot of that in behavioural issues in schools these days. And so I'll come back to what's the one thing that we can try and improve on that, and that is hearing. Hearing loss is a developmental emergency. And I say that so strongly again, that hearing loss is a developmental emergency because it is so, so important. And if you're worrying about the hearing by the time you get to high school, we have missed the boat. We need to be working as hard as we possibly can from the age of 0 right through to that first years of school, even the first and second years of school, to make sure we've got the balance right. If we set them up appropriately at that early stage, then our kids can achieve whatever they want to achieve. And so one of the nice things about Aboriginal health is that because we're looking after the worsties in the world, if you get it right for us, you're going to get it right for every kid. And I really take pride in that with my patients, because my patient mix is a very, very broad mix. And so when we get it right and show how important hearing is, I make sure that all my kids that I look after get that same kind of opportunity. And I really instill that and have a real sense of pride around making sure that's done. Where we do really well in that is that when we get the message out there and parents realise that, then that's when they can jump up and down and really strongly advocate for system-wide changes to make sure we're getting on top of this.
Can we talk a little bit about what is actually going on with that hearing loss in young children? What usually do you see? Yeah?
There are two aspects of the hearing loss which I think is important for our listeners to note, and that is there is the nerve and there is the mechanism of how we capture sound. In terms of nerve, every kid born in Australia is tested for their hearing. So when you have a baby in the hospital, you are tested for your hearing and we check it straight away, and that's a nerve. And so good is that program that they're trying to roll those programs out worldwide. But we know that if we capture that early part of hearing loss and implant those children, then their natural progression on their education is going to be equivalent to any other kid.
When you say implant those children, what does that mean?
A cochlear implant, where you can actually implant and make them hear again, and that's wonderful. So in the early days, it's quite hard to make sure we actually push harder for the early kid to get it. But we know, I've seen kids I've implanted who are, ducks at year 6. So they've gone from a world of not hearing to a world where the world is the beginning of their life, and that can be whatever. And I've probably met the future Prime Minister, or can I be cheeky to say I've met our future President? That's how important it is to make sure the hearing's good. Then you got that, which people then are happy the nerves working. The second part of it is the conductive components. That's how sound is captured. And the best way to think about it is like a kitchen sink. Your kitchen sink should be empty all the time, and that's your ear. The ear is like a cavity, and it's like an opera house, and so you're hearing really well. If the kitchen sink's filled up with water, it's muffled and doesn't actually hear all that well. And so all kids get the kitchen sink, like the one at home we have, fill up, empty out, fill up, empty out. And that's normal progression in life. But if it fills up and overflows, then there's something wrong with your plumbing, there's something wrong with the ears. And what we find in our children is that we have a propensity where we get this thing called otitis media, where you're getting more of this fluid and more infections associated with kids. Now, all kids in Australia get this. No kid escapes this. But what we see the difference is most kids get it for a little bit and you don't need any intervention. Some kids get it a little bit more where you might need to have an intervention or some antibiotics. And then in our vulnerable population, which I think is related to social determinants of health and access, is that they get it for a lot longer period. And so in our kids that we look after who are vulnerable, we're finding that their hearing loss is actually there present for about 3 years of their first 5 years of life. 3 years of your first 5 years of life not hearing. That's absolutely devastating. And so, again, if I go back to that sliding doors moment where you actually pick up a kid, if I can pick up a kid early and note that and fix that hearing, then that kid has got every opportunity they've got in their life. And that makes my heart sing because you see that difference in it. And when you look after kids with otitis media and the parents come back and the kids come back, they are different people. The parents are happy because the kids are sleeping. The kids are happy because they're singing and dancing, and just those small nuances that you pick up that you don't appreciate. You know, I had a kid come back recently who kept flushing the toilet and going, "Mom, come and listen to the waterfall in here." And it just made me smile. It made my heart sing because these are the things that make us laugh, which are really good. But the reality is that kid was missing out on so many important social cues and sound, and that would impair their learning and their long-term developments, that we've changed that forever. And if you change that forever, they're going to be whatever they want to be, and that's really cool.
Now, the age group that you're talking about specifically is from 0 to 5 before they get to school?
0 to 5 is probably the 0 to 4 group is a bit I've been working more and more on lately. When I was going through my training, it was kind of that preschool, kindergarten area where they're really honing on there because they're starting school. I want to make sure that's where the hearing's good. But I've started realising that yes, that's really important to pick up on that. And any hearing loss we pick up there is very important from a schooling perspective. But if we go back 2 or 3 years prior to that and make sure the hearing's good well before they even think about starting school, then you're going to set that kid up for a good future in education lifelong. And so I've really been trying to, and the hard thing is that when you've got those listeners who have had 2-year-olds at home, terrible twos or three-nagers, all those kind of words we use around that, some of that is due to hearing loss. And so we need to try and tease that out. And how do we pick that up? How do we actually know it's a problem? How do we know that it's something that we need to intervene with? You know, when a kid's got a cute little lisp or they've got a cute little way in which they pronounce things, we like it. It's quite cute for us. It's endearing to us. But what we've got to realise is that actually this might be a problem. We need to get onto this. So a lisp becomes a lifelong learning issue. Not talking all that well becomes a lifelong issue. Stumbling and falling over because your balance is off becomes a lifelong issue. These are all cues that we need to somehow objectively pick up, notify, and get the help we get to.
My guest today on Wellbeing is Dr. Kelvin Kong from the University of Newcastle's School of Medicine and Public Health. He's an otolaryngology head and neck surgeon. Why are Indigenous children among the most affected groups in the world when it comes to chronic ear infections and hearing loss?
I wish I could answer that question so eloquently for you, but it's a really hard question to answer. And the reason I think it's a really hard question to answer is because for many years we've been talking about some of the microbiology, the anatomy, the genetic makeup, when a lot of the time it's coming back down to social determinants of health and basic healthcare access. And we talk about the first 2,000 days in New South Wales, looking after kids and make sure they grow healthily. And we need to come back to making sure that even before a kid's born in pregnancy, we need to make sure there's a really good, healthy pregnancy, that we're looking after early pregnancy and make sure that development is good. But then when we get through to that early years of life, we need to make sure there's good nutrition. We need to make sure there's good environments they're living in. And so some of these access points make it quite difficult for us to get those. And so again, we get a bit of fluid in an early 1-year-old where someone can actually address that. In a lot of these vulnerable kids, so that's our Indigenous kids, that's our refugee kids, that's our out-of-home care kids, they don't get that kind of nutrition, they don't get that kind of access to healthcare. And by the time people are starting to realise it, you're starting to get along with it. So where I'd normally pick it up in my normal population around the 18 months and 2 years of age, I might be seeing our other kids, the vulnerable kids, around 4 years of age or 5 years of age. So they're already a couple of years behind that. So we need to somehow bring that forward to make sure that we're picking up on those earlier aspects. Number one, to diagnose it and make sure they get the support around them. And number two, then to make sure you got the access to care, because anyone who's called up for any kind of medical specialist appointment realises how hard it is to navigate the system in Australia. I still say with a hand on my heart that we've got the best health system in the world, but we've got to manipulate that to make sure we utilise it. And so part of the job for us on the other end of the spectrum is then how do we change that system to make sure that the system picks up those vulnerable kids, but really picks up any kid with a hearing loss. like the newborn hearing program, which is such an impressive program because the screening is so good and so universal that it becomes part of our natural life, that you don't have to be an ENT surgeon to pick up on some of these hearing difficulties. You don't have to be an ENT surgeon to realise that the kid's not developing normally. And so when we see those social cues, then we need to make sure that we say, rightio, there's a problem here. What do we do next? And that what do we do next then is that bit that's really important for the health profession to pick up on.
If you miss it once they're in school, is it too late to do anything about it if it's a medical condition? If they're 6, 7, 8?
No, never too late. I think the most important thing is that it's always important to intervene whenever you find out these issues. And those issues can vary. So when you start getting to 8, 9 years of age, you might have had all the complications or the sequelae of that. So a lot of the places I go to, they have no eardrums because their eardrums have been perforated, had that many infections over the years. And so they got no eardrums. So then you need to fix the eardrums and make sure that you're getting rid of the infection. But then you need to look at what the residual hearing is. Hopefully you can get to some kind of normal hearing levels. But if you can't, then what amplification can we use to make sure that's okay? So hearing and ear issues are a lifelong issue we need to make sure of. And I think if we move away from that early infective phase, I'm now looking at teenagers who wear the earphones, iPods, ear muffs and all those things way too loud. So we're starting to get a new lot of hearing loss that's going to start happening in the next kind of generation. So I think our ears are just so important, and they're such delicate, fine instruments that we need to really put the awareness out there about how important they are for lifelong health. And even when we're looking at our elderly population, if you keep and maintain good hearing, then your social cues, your social interaction, your chance of going to a nursing home are decreased significantly. And so at the other end of the spectrum, I'm trying to make sure that all our elderly population with some kind of mild hearing loss are aware of the hearing loss. They should be wearing hearing aids where they can. If they can't wear hearing aids, then go see an ENT surgeon, make sure that something's done to fix hearing. Because if you fix your hearing, you're decreasing your chances of dementia, you're decreasing your chance of ending up in a nursing home, and you're increasing your chance of this thing called healthy living and healthy aging. I think with us becoming an older population now, this is going to be more important than that. So from cradle right to death, hearing is just such an important issue. And, I'm really glad to be able to talk about this because I want all of our listeners not just look at the kids and say, I need to make sure my grandkids or my kids are looked after. You need to look at the mirror and say, hang on, how have I checked my hearing? How about check my parents' hearing? How about check my grandparents' hearing? Are we making sure we're all on top of this? Because there are so many health effects associated with it that we don't appreciate as much of at this stage.
Age-related hearing loss, they call it, don't they? And you become more and more isolated very, very quickly because you can't hear properly.
Very quickly, and people forget how quickly that occurs. But also, I think vanity sometimes takes over and you don't want to wear a hearing aid because of these. But because hearing aids now are so in tune, and Bluetooth connectivity and wire connectivity and television and speakers and these kind of conversations make it so much easier for us, that I say it again, that hearing is just so important, and just the fabric of our culture in Australia, the fabric of our enjoyment. And everyone knows when you listen to your favourite song, how much that can make you smile and put you in a good mood. That's hearing for you. That's our brain translating these kind of notes together. It makes us have a happiness there. When you hear a kid laughing, you hear that laughter of a friend or an old friend not seen for a long time. You hear a belly laugh in the background. It brings a smile to our own faces because we actually engage in that. So that conversation, that interaction, as part of being human beings, we like to interact, we like to talk, we like to communicate in whichever ways we do that. And all I'm saying is that hearing is just one of those aspects that we need to make sure that we preserve as much as possible, and we're lucky enough to have.
I'm talking to you in your clinic today, but you're also involved with a lot of research. Can you talk a little bit about the focus of your research with the Hunter Medical Research Association?
Yes, I'm really lucky because I have a whole research group around me. And so although they thrust me in front as the lead researcher in this group, there's a whole lot of us doing some amazing work. And so the work that we're doing is trying to look at multiple aspects of it. We're looking at health access, which is a really important part. So telehealth in terms of looking at ears through different technologies to poorer access, people can get access to that. We're looking at the microbiology of the ear disease and the bugs that are sitting in your middle ear. We're actually growing the bugs in the lab to see whether we can actually change the way in which the bugs behave. We're trying to develop and grow the epithelium or the lining of the ears in the lab to make sure we can see those aspects. And so from a whole range of things, from access to healthcare availability through to the lab work and antibiotics, we're really trying to examine every part of it and prosecute every part of it to see whether there's things we can improve on to make sure we're improving that development of the hearing.
Can you talk about when it's time to see a specialist and what can a doctor do, a normal GP do?
Firstly, our GPs are incredible. I think they pick up on these things quite a lot. If you are having a conversation about whether I should, the answer is yes. the fact you're having the conversation, raising it, tells me that something's happening from that point of view. So I say that. But before you even see a GP, it's really nice to go get a hearing test. Most places you can get a hearing test now, particularly for adults. You can go to any shopping centre where there's a lot of hearing places. They can check your hearing straight away. So there's online, you can look at resources where you can actually test your hearing online. So you can do it in private. And if you're a bit shame about it or a bit shy about going forward, then you can test it at home. There's no issue from that. But then when you talk to your general practitioner and ask them about what are the options there, I think it's really important to then start talking about getting a hearing test, formalising what that looks like, and then making sure there's nothing medical that we can reverse or correct. Once we know those two aspects, then you start working out what it is in life that you're trying to get out of, and then you can start working out whether or not you need to get hearing aids, whether you need to see an ENT surgeon, whether you need to just make sure that you look after your ears. There's a whole lot of reasons why your hearing changes, and most of them are very simple reasons. And the second part of that then is having the conversation makes us realise we need to protect our ears. And so we're in a society where there's so much noise pollution around us, we need to make sure that there's environments that we look after ears and what is bad. In the old days of BHP in Newcastle, obviously those things cause a lot of hearing loss, but there are new technologies that are causing a lot of hearing loss. And as I articulated before, headphones, earphones, all those things are actually going to be a problem for us. So we need to make sure that we're careful of those. So being aware of these things and protecting you. So if you're in your 40s and 50s and your hearing's great, don't take that for granted. Make sure that, hang on, in the next 10, 15 years, my hearing may go down a bit. What can I do now to make sure I'm protecting that? What can I do now to make sure I preserve that? But then more importantly, when it does go down, what are my plan A and plan B to make sure that I maintain that hearing so that I end up getting dementia, that I end up in a nursing home early, that I don't need to, that I can enjoy my life and enjoy music and concerts still.
You mentioned dementia there. Is hearing loss and dementia related?
There is a spatial link associated with that. And we know that if you have good hearing and you have good social interaction, for so many reasons, you stay involved in society and therefore it decreases or delays that onset from there. There's so much more work we need to do around here to see what that actual link is specifically. But we certainly know that by getting involved in that earlier on, we can actually change those long-term outcomes. And so particularly our listeners who are getting to that older age, back in the old days, again, when I was training, you get to kind of 65, 70 people thinking that's old. That's young now. That is super young now. Our population is getting so healthy as older age, but as we're getting to that older age, we need to make sure that the hearing's on top of it as well. So yeah, absolutely, it's strongly related to it. Cognition, it also can be related to cognition. So people who sometimes are forgetful or don't remember things, sometimes you put a hearing aid on that start engaging in society better, hearing better, that all comes back to them again. And so we're starting to see these correlations. And so it's fascinating to see, particularly as I'm getting older, I'm getting more aware of these kind of things. And I'm keeping my finger on the pulse, so to speak, to make sure that I'm looking out for kind of signs in doing those aspects. Same as when you wear glasses, the first time you wear glasses, and I'm now at that age where I'm starting to wear glasses or reading or driving, and the first couple of times you think, oh, do I have to do that? And now you just wouldn't go anywhere without them. And it's the same thing. I think you need to start thinking that kind of attitude with your ears. And because they're getting smaller, because they're getting more versatile, because they're getting a lot more adaptable to the way in which we live life, people are much more accepting of it. And because they're much more accepting, I think, therefore, they give us talking points to actually engage people with. And so it's our job to make sure we do that.
What role do governments and health services and education systems need to play in helping people have better hearing in Australia?
Oh, and a very, very important role. I come back to those systems and structures which really denied a lot of the earlier access that we had to hearing. From a school perspective, we need to make sure that we're not just putting things down to behaviours, and we're not just putting it down to our biases, that we need to make sure that if a kid's not progressing, one of the first things we should do is send them for a hearing test. So to note home to the family, say, please get a hearing test, just make sure everything's going okay. In a classroom where there's a high proportion of kids who are hearing loss, some of the remote communities I go to, the simplest solution was buying a loudspeaker and making a teacher wear a microphone. You can't get hearing aids on these kids, make a speaker loud so they can actually hear those. Again, the issue of the hearing will get sorted out with time, with access, but the important part is the public health policy there and making sure the education is instilled. Again, I come back down to we need to make sure that we're getting the education we need to get this thing called life. Not look after an ear per se. Looking after an organ is not the way in which it is. We look after a whole person. And as we're getting older, then workplaces need to be aware of the hearing and the hearing ramifications we have in what we're doing. And then again, when you're getting later stages of life, and also government policy is making sure that if you are in that age group that needs hearing aids, that we have policies to make sure you are granted those hearing devices. And we're very lucky in Australia, particularly the work that Hearing Australia do, a shout out to them, who do amazing work to make sure that we maintain that healthy living and healthy hearing as we're getting older. And there's a lot of good hearing service providers that do the same kind of thing. And our government provides those policies to make sure they're supported, that they're reinvested in those, because we know that if we get healthy aging population, that we're going to get a better contribution to society. We're going to have people in the workforce longer, which means the government gets more taxes, which means more productive, which means we're all happier. And so we get to enjoy life again. So it's those whole of society things that we need to make sure we're doing to go forward, to make sure we're all going and living healthily as we're getting older.
Yeah, win-win. Final question. If we were to revisit this topic 10 years from now, what progress would you most like to see in Indigenous health and childhood hearing outcomes?
I would like to be not talking about this subject. And I think if we've done this and we've set the systems up correctly, like newborn hearing and the way it's working, is that it's this automatic response that these are higher vulnerable kids. We need to make sure the hearing is good. Let's just test it. It's not a question. We do it as part of the process. If we do that as a normal part of it, then we don't have to worry about it, because then it's going to link in the systems. I think if we can achieve that as a huge public health issue, then we can move forward to that, because everything else falls into place. People in medicine love medicine, and that's why we go into it. And so that's not the issue in trying to get the passion there. It's about how to actually set up the structures to make sure that in the society that we live in, where we've got the best healthcare access, that we are judged by those who are the most vulnerable, and that we bring them along the journey with us, so we can have a wonderful society we live in, that we all smile and we go look back at our grandkids and all have a laugh together and watch them sing and dance.
Thanks, Kelvin. It must be wonderful to have a career where you make so many people smile so much of the time.
Thanks so much, Graham. Appreciate your time.
Thanks a lot.
I've been talking to Professor Kelvin Kong, consultant ear, nose and throat surgeon, Hunter New England Health. Thanks for listening. I'm Graham Wilson, and all of us at Wellbeing wish you well.